So my talk today based on sepsis cascade, and I'll be giving you a very simple theory on sepsis and why it is important and why we need a collaborative work in order to overcome this issue. Okay, this is how I'm going to talk. First, general information, sepsis. So we all heard the term sepsis, but actually we don't know what the sepsis really is. So sepsis is a life-threatening medical emergency, similar to myocardial infarction, ischemic stroke, and it kills. So that is, and it's spread across all disciplines of medicine. So that is why we need a collaboration. So it's clinically defined as result of three converging elements. So what are these converging elements? Number one, life-threatening organ dysfunction. If you were to describe sepsis, you have to have this. That is, there has to be evidence of organ dysfunction. And this organ dysfunction has to be due to overwhelming immune response. Your immune system acts against you. And all these things has to be secondary to infection. So if you have these three elements, you call it sepsis. So to diagnose sepsis, you have to show that these three elements are there. If you have two elements, that is not sepsis. For example, here I have tried to show you the interaction. That is life-threatening organ dysfunction, the first function, dysregulated immune response, and infection. When you have all these three elements, you call it sepsis. If you have two things, infection leading to dysregulated host response, that is not sepsis. Infection leading to life-threatening organ dysfunction, that is not sepsis. Dysregulated host response leading to life-threatening organ dysfunction, that is not sepsis. Let's see what is it. Infection and dysregulated host response, so that is infection-induced immune dysregulation. For example, if a person is having myocarditis due to viral myocarditis, virus infection, it acts on heart muscle and it causes dysfunction. So that is not sepsis because there has to be immune system involvement. The second one, infection leading to life-threatening organ dysfunction. So that is infection-induced damage. Here, dysregulated host response leading to life-threatening organ dysfunction. So that is also not sepsis. Dysregulated host response, life-threatening organ dysfunction, that is catastrophic inflammation. Just like in Still's disease leading to hemophagocytic syndrome. So these things are very important to identify because the managerial process is different, sepsis and other conditions. If you take sepsis, sepsis begins with entry of pathogens into body. So without this, sepsis doesn't exist. So you have to have this part. An entry of organism initiate a cascade of events which can progress to sepsis. What happened? Organisms gain entry and it induces sepsis, immune dysregulation, and that triggers a cascade within the body at subcellular level. So that is the pathogenesis of sepsis. Okay, so in sepsis, so there will be interaction of three systems, main three systems. What are these three systems? Innate and adaptive immune system. The second one is the endothelium and microcirculatory system. The third one is the coagulation and complement system. All these three systems interact with at one go in sepsis. So therefore, you won't be able to differentiate it. But you will see a mixture of manifestations of organ dysfunction involving these three systems. Operation of these cascade causes dysfunction in all above systems. So that leads to dysfunction of all these systems. So what are the molecular pathways? So sepsis starts with pathogen-associated molecular patterns. So those are the parts of microbes, be it a virus, be it a bacteria or a fungus. So when they enter into the body, they produce certain molecular patterns. So we call them pathogen-associated molecular patterns. In the body, in immune cells, so there are different types of recognition molecules. We call them pattern recognition molecule. once this pathogen-associated molecular patterns binds to pathogen recognition molecules in immune cells, so that will trigger whole lot of downstream reactions, and that has a major role in pathogenesis of sepsis. So all the things start with pathogen-associated molecular patterns interacting with pattern recognition molecules. So this is what happens. Infection, you can see pathogen-associated molecular patterns, and it produced by immune. And if the immune response is controlled, so patient will recover. But when the immune system dysregulated, it leads to overwhelming immune response, ultimately leading to organ dysfunction, and that is sepsis. Here you can see the initial excessive inflammation due to infection, and subsequent, so we call sepsis as a biphasic disease. So it has two parts. Phase one is initial excessive inflammation, so there will be hyperinflammation. Subsequently, you get immune suppression. Here you can see with this report, initially there will be pro-inflammatory cytokines and pro-inflammatory mediators acting at a higher level, and subsequently it will be leading to immune suppression. If a patient dies within first part of the sepsis, so most likely that is due to overstimulation of immune system. Subsequently death after 30 days, like that is due to immune suppression. So all this immune manifestation is the hallmark feature of sepsis. So what happened? So dysregulated response leads to severe consequences, leading to widespread activation of endothelial cells and complement system. So these two systems are very important for continuation of this trigger, endothelial cells and the complement system. So you might know in your physiology knowledge the role of endothelial cells in activation all these things. So what happened? The process result is impaired vascular permeability, leading to tissue edema and microvascular dysfunction. So this is the pathologic basis of sepsis. Up to this level, you won't be able to diagnose it. Once this passed, it leads to macrovascular manifestations where you will be able to monitor the patient. The initial part, which is due to vascular leakage and intravascular thrombosis, is the pathogenic hallmark of sepsis. What happens? Once these microvascular changes happen, it leads to dysfunction of all these organs. So now you will be seeing them as a clinical manifestation. So this whole process, it can affect the liver, the gut, the brain, heart, adrenals and endocrine system, kidney, lung, circulation, coagulation, all these systems. So triggered by immune over response. So what happens here is, once this capillary network is impaired, it leads to multi-organ failure, and it manifests as ARDS, delirium, acute kidney injury, clotting abnormality, and bacterial translocation, that is through gut. And how are you going to identify this microvascular thrombosis and leaking, which leading to organ dysfunction? So that is through SOFA-score. In SOFA-score, what you are looking at is the organ failure, which is generated by microvascular changes. Okay, so what is the individual system response? Here you can see immune system, complement system, coagulation system. So all the things happening inside the body is due to interaction of these three systems. Okay, another thing is both adaptive immune system as well as innate system play a vital role in pathogenesis of sepsis. So if we don't go by these subcellular changes, we won't be able to have a better understanding on sepsis. So here we can see what happens. There will be initial activation, subsequently leading to immune suppression. So immune cells also like that. So what is the function of neutrophils? What is the function of macrophage? They will kill bacteria. They will try to engulf bacteria. In sepsis, what happens? Their action will be stunted, stopped. And B cell, T cell also like that. So there will be selective T cell apoptosis. So that leading to immune suppression. What about the coagulation system? So the effect of coagulation system in sepsis is called immunothrombosis. And the immune system causing thrombosis. And once the thrombosis is happened, when it consumes all these coagulation pathways, it leads to enhancement of a fibrinolytic system and leading to bleeding. The immunothrombosis, this process, is common to many diseases. Inflammation, maybe hypersensitivity, all these things is mediated by immune thrombosis. So this is a physiological process that links the immune system and the coagulation system to combat pathogens and tissue injury. So this is what happened in this process. I don't have enough time to go with this, but there is a lot of coagulation factors involving in this. Von Willebrand factor, the ADAMST, everything interacts with this when you have the ultimate changes in the capillary level. All these things happens. Okay. So now let's see why we need to learn about sepsis. Let's see the burden. 55 million cases per year. 11 million deaths throughout the world. So if I tell you 2.5 times the population of Sri Lanka per year, a similar number in worldwide get sepsis. 50% of the population of the Sri Lanka, the population equal to this, dies from sepsis. So that's a huge number. And what happened? If you consider the deaths, worldwide there will be 60 million deaths. There will be 11 million deaths due to sepsis. 1 in 5 cases deaths due to sepsis. And low and middle income countries, huge number of deaths compared to, and under 5, 2.5 million deaths a year under 5. So that is our future. Pregnancy, 287,000 deaths a year. And in Sri Lankan data, you can see sepsis and infection, which account for 15% of the maternal deaths. The Sri Lankan maternal deaths is around 25 to 30 per 100,000 live births. So you increase it by the population, you will see that huge number of maternal deaths are caused by all other deaths, the congenital problems and all these ASDs, VSDs. So, but sepsis happens in the normal individuals. Despite this high morbidity and mortality, sepsis remain under-recognized as a major public health concern. So that is because we have been functioning in isolation. The physicians will work as a physician, surgeons will work as surgeons, anesthetists will work as anesthetists, and they work within their domains. So there is no cross-discipline communication or cross-discipline activity. So that is the major reason for this, because once my borders were crossed, so it is not my problem. So the idea of having this sort of a discussion is to inculcate the habit of cross-discipline activities. So that is why you need to be a member of Sri Lanka Sepsis Alliance. To enhance sepsis care and reduce preventable deaths, the Surviving Sepsis campaign guidelines were developed. Okay, so now let's see Surviving Sepsis guideline. Surviving Sepsis campaign guidelines were developed to save lives and improve the quality of care in patients with sepsis. So that was the whole idea of having these guidelines. And these Surviving Sepsis guidelines, so there are 93 recommendations which are coined under 7 major domains. So if I were to tell you the 7 domains, I have categorized under 5. Initial screening and resuscitation, diagnosis and infection, fluid management, ventilation and additional therapy, long-term outcome and goals of care. So these are the major domains that our speakers are going to talk about. Okay, so out of that, can you see number of recommendations? 30% of recommendations are on infection. Why? Infection is the one which causes sepsis. And when you refer the guidelines, so there are few words, important words. So it says, number one, the term, the guideline, it has we recommend. So when the guideline says we recommend, so that is a best practice statement. So it is given in this. So if you go the visual guide and you will see this mark. So that says it is best practice statement. And the second one, the term we recommend is again used to strong graded evidence recommendation. So it is given in this 2 exclamation point green. So that means recommendation for. When you see 2 exclamation points in red, so that means recommendation against. So when you see this in the visual guide of recommendation, you can say now this is a strong recommendation and this is the strong recommendations against. And the other term that we use in this guideline is the term we suggest. Once you say we suggest, so that is most likely a single explanation. So that based on weak recommendation. And the red one recommendation is weak recommendation against. So now when you don't have anything, so there's no recommendation for particular practice. So when you refer the visual guide of Surviving Sepsis Campaign Guideline, this is very important. Okay, so then the quality of evidence. Again, this guideline has given quality of evidence in front of each recommendations that I have mentioned earlier, 90 recommendation. If you see this high quality evidence, 3 moderate quality evidence, low quality evidence, and very low quality evidence. So it is very easy for you to get what recommendation has higher grade of recommendations. And then with the last Surviving Sepsis Campaign Guideline, whether this is upgrade or downgrade. So that is also given there with no change. So the recommendations were carried out in 2021. And other thing is, in this year, the latest guideline is due. So strong recommendations were made on high quality evidence. As you can see from here, so it can see strong recommendations for, strong recommendations against, and the quality of evidence is given in the guideline. So similarly, about the resuscitation and hemodynamic management, all the things are there. And then the degree of evidence is given. So what are the key takeaways from Surviving Sepsis Campaign Guideline for a country like ours, so that we are low and middle income on income and our care is in par with high income, the healthcare is in high income level. So that sort of country, what are the key takeaways? Number one, Surviving Sepsis Campaign Guidelines are a good stepping stone to create our own plan. Second one, key messages for us. You have to suspect sepsis based on clinical signs and symptoms. Okay, always suspect. Start antibiotics early. Simultaneously initiate the resuscitation part. Identify the cause, identify the source, and try to control it. So aims of all above steps is to prevent preventable deaths from sepsis. And one word about sepsis and sepsis mimic. So there are conditions which mimic sepsis, because all these things are due to interaction of immune system, coagulation system, and complement system. So there are sepsis mimic, especially which happens secondary to damage, and it is mediated by special type of molecules called damage associated molecular patterns. You see a patient with acute pancreatitis, so they can go into sepsis like symptoms. So we call it sepsis mimic, but on clinical grounds you won't be able to identify it. So sepsis mimics are the conditions that present with signs and symptoms similar to sepsis, but actually not caused by sepsis. So there are many sepsis mimic conditions: infection mimics, cardiovascular conditions, metabolic disorders, inflammatory conditions, allergic reactions, trauma, and other. All these things can present as sepsis. Very difficult to differentiate. So sepsis versus catastrophic inflammation. Again, dysregulated host response leading to organ dysfunction. That is catastrophic inflammation, as in antiphospholipid syndrome. So you get similar to sepsis, but not actually sepsis. So here is the symptom sharing in sepsis and catastrophic inflammation. Okay. So sepsis mimics are triggered by damage-associated molecular patterns, but not by pathogen-associated molecular patterns. So there are three major issues with sepsis. What? Clinical symptoms are not specific to sepsis. So that's one problem. Second one, no biomarker has sufficient sensitivity or specificity to identify the sepsis. So this is what the second thing about the sepsis. The third one, sepsis is a time critical. Any delay in initiation appropriate treatment with antibiotic, the mortality will go up with the time delay. So stop sepsis before it starts. So that is our aim. Preventing preventable deaths from sepsis. What you can do is to be a member of Sri Lanka Sepsis Alliance, and it is open to everybody, and you can be a part of this proud team who are aimed at preventing preventable deaths from sepsis. Join Sri Lanka Sepsis Alliance and be a member of the multidisciplinary team, and whole KSM can be members. Thank you very much.